Hi, this is Dr. Andrew Hall from WellSpine, Kansas City, and this is my wife, Dr. Liisa Hall, also with us in the office, and we're back today to answer more questions that we see on Facebook that we often get in the office as well. And one of the big questions that we hear all the time, because we see so many kids in our office, is why should a child get their spine checked and also be getting adjusted? And I'm just going to throw that over to you, Liisa. Why do people do that?
Well, I think it makes sense to a lot of people to have their children's spines checked, but more often when there's a problem. Ear infections, bedwetting, asthma, allergies. The truth of the matter is we start experiencing trauma on the day that we're born. It's just as traumatic for baby oftentimes, sometimes even more so than it is for mom. And so we check children for nerve interference, for something that's blocking the brain and body from having normal communication, typically as a spot on the spine that's not lined up properly. So we look for that in order to help children grow up healthy and develop optimally rather than waiting for crisis to set in. We've talked before about how symptoms can show up at the very end of a problem, sometimes decades later. And as a kid who suffered with asthma and allergies and was sick a lot, I didn't even experience chiropractic care until I was 12. And honestly, I think 12 years old was way too late for me, and I could have suffered so much less having gotten care sooner. But most importantly, I think it's really critical that people understand not to just bring their kid to a chiropractor, but to have their child see a chiropractor who specializes in children's care. It's not the same as adult care.
No.
They're not just little adults. People often say that. They're not. They have very different bodies. In fact, the bottom part of the spine isn't even done developing and fusing until our 20s. So there's a lot of different developmental milestones that children should be hitting at very specific points in their development. And pediatric chiropractors like ourselves, who have a lot of advanced postgraduate education in pediatric care and pediatric neurology, we just look for things differently. We also know that it's not true what our medical doctors often say, that oh, they'll grow out of it, or oh, some kids are just slower. Some kids are slower because they're not hitting their developmental milestones because there's a problem, not because they're slow. And so knowing if that's true or not is really important, because it can be the difference between your child missing more days of school, but even it can be a difference between your kid moving on to the next grade or succeeding in class or even athletics.
Yep.
And that means the world to us. We just love taking care of kids.
Love taking care of kids.
And helping them do so great. So when people see happy, healthy kids running around who are typically above the norm, doing better than their peers, they're surprised to see them in a chiropractic office saying, well, there's nothing wrong with them. We're saying, that's why there's nothing wrong with them. It's because they're well adjusted, well taken care of, and they're happy to get their safe, gentle adjustments, which we, again, specialize in doing. So it's not aggressive. It's really easy care, and they love getting adjusted.
Yeah. And you also have to think about, kids have a lot of trauma just growing up. I think about how I grew up with my brothers and sisters and how you grew up with your family and out on the farm. They say the average kid or the average child learning how to walk falls 25 times per day. So I want you to imagine falling down 25 times.
In a day.
Per day. I mean, your spine would be a mess after that. And again, kiddos need that because there's been a lot of trauma in childhood. So that's just in a nutshell why we take care of kids. We see them all the time. We're a very busy pediatric office, and we love checking kids, and it's part of our practice and part of our passion. So thank you very much for taking the time with us today. Make it a great day.